Hi, I'm Dr. Burke, and welcome to Medical Minute with Norton Healthcare. One question that I commonly hear from patients is, what is a trigger finger and how do you treat it? A trigger finger is a temporary sticking or popping when you bend your finger. It can happen to any finger or even the thumb. More severe cases are painful and the finger will get stuck in a closed position. It's a common complaint seen in patients over the age of 40 who use a tight grip repetitively for work. Women and people with diabetes are more likely to develop this condition. Treatments can range from rest to surgery depending on the severity of the condition. Resting your hands if possible, wearing a splint at night, stretching and getting steroid injections can all reduce the symptoms of a trigger finger without surgery. If surgery is required, it's a procedure with a high success rate and doesn't require an overnight stay in the hospital. It is important to remember that every patient and diagnosis is different. If you have questions about your specific condition, I recommend you talk to a provider about a treatment plan that is right for you. For more information or to schedule an appointment, visit nortonorthopedics.com.